If you've been following this documentation improvement series, today's video is part 3 of that collection. It's geared towards US-based clinicians, particularly PTs and PTAs. And today, I'm giving you 4 more incredibly useful tips in elevating the quality of your notes. Stay tuned.
Are you ready?
Hey guys, mga moms, mga becks, mga beshies, mga dude parichong, it's me, Baby G. Welcome back to my channel. As clinicians, we have to make an effort to elevate the quality of notes that we present to the different payer sources who determine if what we did was skilled and medically necessary. This is a challenge to many because even though we provide great patient care, putting it into writing is a different story. So if you're feeling stuck or your notes need revamping, then you've come to the right place. I guess scoring 30 in the writing section of the TOEFL 3 times has helped me a lot too. But just as a shameless plug, I made it to the community newsletter. I was named Leader of the Month for February, so I must be doing something right. The first Filipino recipient of this award in this community, so like go Philippines, like that. Anyway, later in this video, I will give you some more tips on how to strengthen your documentation skills. I'd post the links up here or here to make it easier to get to them. When you like and comment in any of these videos, it helps boost this channel in YouTube's algorithm. So I would appreciate it when you do that and subscribe as well. Kaya go, push mo yan, te, like that, yes, the like and subscribe button. A quick background on my education and experience. I'm a Filipino-trained physical therapist. I graduated in 2007 at the University of Santo Tomas College of Rehabilitation Sciences, and I was the most outstanding PT intern. After passing the local boards, I worked briefly at the UST Hospital before laying the foundation for LGBT PTs at the Philippine Heart Center, Physical Medicine Rehabilitation Division, ganun, pioneer. I was the first one to introduce computerized notes to the charting system. To get away from handwriting too much, it's tiring, but even the first one doing endorsement notes printed on index cards. Well, looking back, maybe it was a premonition for what was to come when I moved to the US, which I eventually did in 2013. My first clinical setting was at a skilled nursing facility. It was a really big change from the usual soap notes that I was accustomed to doing in the Philippines. But through the guidance of experts, like shout out to Sir Chris, perseverance, being highly adaptable, and having high-functioning anxiety, I was able to develop and tailor the style of my documentation to the standard that they have here in the United States. I've had positive feedback from the internal auditors across all the buildings and organizations I have been a part of. I've never had to personally talk to a Medicare auditor, but I have second-hand experience of the feedback that a former manager friend of mine had as to the things that was asked during a call with that third party. But alam ni si Bax o si Sarah, so charot, ganun. Anyway, that quick background almost turned to a recap of almost a third of my life. So I'd save that story for another day. So to avoid having that dreaded call with external auditors, let's head into the other documentation tips. Number 1, check active goals. Make it a point to check the latest major document, whether it's the eval, progress note, or recertification, and see what the active goals are. You don't want to be documenting activities that are not geared towards any active goals. Goals depend on a variety of things, especially depending on which setting you're in. Skilled nursing, assisted living, outpatient, home health, whatever. On a separate video, I will talk about looking at the bigger picture and pinpointing impairments and functional deficits that can be addressed in the goals section. How can we make our goals better? But for this tip, consider writing something like this. So in this goal, you want to improve the dynamic standing balance to reduce the risk of falls in standing. So we have to detail what you were doing and see, even with this, it's we made it a little more complicated by adding a mental task, counting backwards from 100. So it's important to make sure that you state like what was the goal that you were addressing at the start so that it's clear. It's an active goal. So yeah, that's a good way of writing that into your daily note. As always, you want to put that you provided feedback and that the resident reported understanding. Number 2, choose appropriate outcome measures or standardized tests. The APTA states that outcomes are important in the direct management of individual patient care and for the opportunity they provide in the profession, in collectively comparing care and determining effectiveness. It is up to us as the evaluating therapist which particular outcome measure to use. That would reflect the impact of our chosen interventions. Is your patient bedbound, deconditioned but has potential for sitting, standing, walking, with or without assistive device? Is the patient's highest functional capacity just using a chair, a wheelchair? All of this information play a role as to what test you would choose. In a separate video, I would talk about clinical decision making and clinical reasoning skills for choosing appropriate outcome measures for each kind of resident, and I will post links of the tests as well. I actually came up with a form that I bring to my evals. I'll put it up here to see which ones are appropriate for the residents. But for this tip, here are 2 ways of incorporating addressing outcome measures into your daily notes. Ching! Like that. So for this note, we're gonna work on gait training, but what we're gonna do is we're gonna relate it to the goal for addressing DGI, like the dynamic gait index. So in this note, we're saying that there's a change in the speed and that this was done as part of addressing the goals of improving the score on the DGI, which relates to risk of falls in older adults. So if you have a goal using a standardized test, if you break down the parts of the test, you can actually incorporate them into the daily note that you're doing, including obstacle, negotiation, and all that. Another way of documenting standardized tests, especially like into your evals, is like this. So you want to put in the complexity of your decision making and which tools did you use in the assessment. So for this example, we're using the 2-minute walk test. I like to indicate what's the normal data for people in their age range, what's the MDC, the minimal detectable change, so that when you set a goal, so if the MDC is like 40, so set a goal for higher than 40. Indicate like what the other tests are, like 2-minute step test for aerobic capacity, functional reach, compare it to what the normal is for geriatrics, which is like 10 inches, and like single leg standing. So it's like there's like a battery of tests that you can do that can really strengthen your documentation, particularly your evaluation, and how you can write it into your daily note. Number 3, correlate your session to prior visits. Make sure that you take time to review notes from previous days, especially if other people have worked with the patient since the last time you saw them, so that you're all on the same page as to the plan of care for that patient. It would guide you not only as to the weights they've been using or how far they've been walking. It would actually guide you as to the quality of progress the patient has been making throughout the course of their stay. Is the patient steadily progressing, fluctuating, or declining? Maybe they're having an off day today. Maybe they have DOMs from a heavy workout the previous day. All this information play a role in your documentation today. You have to think, what did I do as a therapist that was skilled? Your note could read as follows. So in this example, the therapist discussed to the resident how they have been doing compared to evaluation, especially as to her functional mobility. So now the resident is standby to supervision during bed mob tasks. You break down the task if you want, but compared to how she was doing before. So before she was like min to mod assist. So if you break down those information and someone would read the note, it's good to see, what the progress are. How has therapy helped the resident so that they can track the progress. So towards the bottom, like they talk about sit to stand activities mimicking the elevated recliner she has in her apartment. So it's good to mimic what the home situation is so that it's something that would be functional for the resident. All this information, for as long as it's there, it's easy for anybody looking into the note to see how you have helped as a therapist in communicating the progress to the resident and to other people. So that's why writing this down into your daily note is important. Would you be able to write that, do you think? So I think you should. For the last tip of the day, number 5, document the education you provided to the residents and their caregivers or their family, including their response. Once you train somebody on particular aspects of what you're doing, it is important to document your assessment of their competency of the task. Here is an example. Yeah, sound effect. Like that. The following areas of education and training were provided to the resident and caregivers as to proper guarding and use of the assistive device. Assessment of the effectiveness of training is evidenced by good return demonstration, along with verbalization of understanding of both parties, with current competency rated as 75%. So you note that the 75% competency, they would need continued training to make sure that there's better carryover into the future. You wanted to write something like safety protocols were implemented to ensure that the environment was safe. Well, if you made it up to this point, thanks for sticking around. Leave a smiley face in the comment box down below if you want me to keep on coming up with helpful content. You want to make sure that you're painting a picture of what the resident did during the session, especially the ones that you're working with them. Having those little details in the daily notes help your in-house audit team down the road defend what you build, or even defend you if they call you. You want to make sure there's an accurate depiction of how therapy is important to the resident's progress. Just like what I emphasized in my previous videos, it's important to always put the residents' needs first. What do they need so that they could function better and have a better quality of life? When we prioritize that, everything else will follow. When we provide great patient care, we should also take credit for the clinical decision-making skills we use to help our patients through proper documentation. Hopefully, these series of videos will be helpful in guiding you through your journey. If you found this information useful, again, click the like button, share this to your PT friends, and subscribe to the channel. Still have a lot of content in store for you all. As always, stay safe, wash your hands, practice social distancing, and wear a mask. Until the next video, see ya!